If you ask your doctor for DoxyPEP, there's a good chance they'll say no. We hear it from patients all the time. But most of the time, those physicians are flat out wrong. And today, I'm going to tell you exactly why. Now, probably the biggest reason why a doctor might not prescribe DoxyPEP is because they don't know what it is and they're not familiar with it. Look, I started this company because I had gonorrhea, tested negative for gonorrhea because the test was urine only. When I found out about oral swabs and oral gonorrhea, I went to a physician and that physician said, you don't need that test because if you had gonorrhea orally, you would also have it genitally, so don't even worry about it. That doctor was flat out wrong, and I can guarantee you that that doctor had never even heard of throat swab testing for gonorrhea, didn't want to deal with it, got flustered, and just said it wasn't a problem. And that is not uncommon with physicians. If they're not familiar with something, the easiest thing, and quite frankly, the safest thing they can do is either refer you to somebody else or just deny it outright. That's why it's probably a good idea for you to find a sex-positive physician like at an STI clinic or a telehealth clinic whenever possible. Now, the second reason is because there are some doctors, and this is a minority, but there are some doctors that do not want to do something that they perceive as promoting promiscuity. Let's face it, doctors are human beings as well, and they have the same religious backgrounds and things like that of people from all walks of life. But they also have the public health aspect as well. And if they give you a tool that is designed for you to essentially have your cake and eat it too, to go out and have unprotected anal sex, unprotected vaginal sex, unprotected oral sex, and reduce your risk, some people, including some physicians, feel like, well, that might encourage you just to go out and seek more of that behavior. And they're not necessarily comfortable doing that. Look, I don't think that's the right answer. Let me tell you something about the HPV vaccine. We had this same conversation about the HPV vaccine years ago, that if we give people something that allows them to go out and have unprotected sex, and less people die of cervical cancer and less people die of oropharyngeal squamous cell carcinoma of the throat, won't that just promote people to go out and have more sex, and then they might get AIDS, right? Or something else bad might happen? That's nonsense. Look, if you look at the survey results, modern people here in 2026 are having less sex than ever before, yet we've never had more tools to protect ourselves from STIs. So I just don't buy that argument. But I do understand that there are some doctors who really do feel that way. Now, the third reason are concerns about antibiotic resistance, and this is completely valid. Let's talk about it. Let's face facts here. Look, you've been told your entire life to always finish your antibiotics, and now with DoxyPEP, you're just given a bottle of pills and told to take one whenever you want, right? Take one today, take one tomorrow, take one 6 months from now, just whenever you get laid. I'm being a little crass on purpose to make a point, but that does make a lot of people uncomfortable. And there are real concerns about antibiotic resistance, and it's being studied all of the time. Let's focus on the 3 bacteria that can be reduced by DoxyPEP. Syphilis, no resistance to doxycycline, probably never will. It's a thing that just loves to get killed. It's still killed by penicillin, the original antibiotic developed in the 1940s. Chlamydia, very similar story. People do not have a lot of concern about chlamydia becoming resistant to doxycycline. Gonorrhea has been resistant to doxycycline for 40-something years. We haven't used doxycycline to treat gonorrhea since the early 1980s. Now, what we're seeing is that more and more strains of gonorrhea are becoming resistant to doxycycline, possibly because of DoxyPEP, but also possibly because chlamydia is now being treated with doxycycline. And many people who find out they have chlamydia, like at a pap smear or something like that, undoubtedly may have, for example, an oral gonorrhea infection, which wasn't even tested for. And so that gonorrhea is being exposed to doxycycline. So there's lots of reasons for antibiotic resistance. Let's go ahead and talk about the other bacteria, because I think when you look at researchers and things like that, these are the things that they're actually concerned about. That there's going to be other bacteria that become resistant to doxycycline, and then they're going to spread those genes to other bacteria. It has absolutely nothing to do with STIs, but just other things in general. That is a very real concern. Like I said, it's being studied. However, I would like to present the other side of the argument and why many people in public health are promoting DoxyPEP right now. These bacterial STIs are a huge problem. If we look at syphilis, we had nearly eradicated it from the United States just a few years ago. We thought it might be something that's just gone from society, but it has made a big comeback. And in fact, congenital syphilis, where babies are being born with syphilis because their mothers have syphilis, is a huge public health nightmare. Let's talk about chlamydia for a second. 1 in 15 sexually active young women in the United States, as I make this video, according to research, has chlamydia. And so every time somebody gets one of these STIs and tests positive for it, there's treatment, all sorts of downstream effects from all of that antibiotic usage. So it's not a simple answer of DoxyPEP is going to cause antibiotic resistance and not using DoxyPEP is going to mean that there's no antibiotic resistance. The next one is that it's a binary choice between using a condom or using DoxyPEP. I actually had a conversation with a physician one day who said, why don't people just use condoms? And I get it. I get that perspective, but let me tell you what people often overlook. Oral sex. If you go talk to somebody who's like, I always use condoms until I got in a serious relationship with my boyfriend or whatever, then we got engaged, now we got married. Ask them if they had unprotected oral sex. Ask them if they had unprotected oral sex with the people they dated before that. Generally speaking, they have. People seem to always forget about this idea that gonorrhea, chlamydia, and syphilis, all three spread from oral sex. I know public health likes to talk about what people should do. I like to talk about what people actually do. And I can prove to you that few people use protection for oral sex. You can go to your local Walgreens, CVS, whatever, you will find a whole wall full of condoms. You will not see a single dental dam. So the truth is, almost everybody is having unprotected oral sex. And because of that, almost everybody is susceptible to these bacterial STIs, which are prevented in good part by DoxyPEP. Now, the next reason is if you happen to be a woman is you're probably going to be denied because the CDC clinical guidelines say to prescribe this to men who have sex with men and transgender women. Let's talk about that. At the time those guidelines were written, there had been one study on women, and that was done in Kenya, where most women in the study lied about their participation in the study. It says that very thing in the CDC clinical guidelines. It says that when they took hair samples from the women who said they had been taking doxycycline, most of them had no doxycycline in their system at all. So that study is complete nonsense. So what happened basically was there were no valid studies at the time that clinical guidelines was published. And the CDC does not make clinical guidance with no data whatsoever. However, there is no physiological reason why DoxyPEP wouldn't work in women. When you look at uterine tissue or vaginal tissue in women and doxycycline is present in those tissues at more than high enough concentration to kill those STIs. And so there's no reason why it wouldn't work. Let me give you the perfect example of why obviously it works. When women get chlamydia, what do you think you treat them with? Do you treat them differently than you do men? No, you give them a week of doxycycline and it cures it 100% of the time. The reason why I'm so passionate about this is because these bacterial STIs disproportionately impact women's health in terms of pelvic inflammatory disease, infertility. Like I talked about earlier, if a woman is pregnant, she can pass syphilis on to a child, which is a nightmare situation. I talked earlier about the chlamydia rates in women. It's absurd that we would deny women these tools. It's absurd. Now, we just spent a lot of time talking about when doctors deny a DoxyPEP prescription, but now I'm going to tell you about something that happens oftentimes, more often than not perhaps, when doctors do write a DoxyPEP prescription. Look at this comment I got on a YouTube video. This person went to the pharmacy and it turns out he had a single dose prescribed to him. So in that doctor's mind, every single time this person has sex, they're supposed to go back to the doctor and get another prescription for DoxyPEP and then go back to the pharmacy. That's utterly ridiculous. DoxyPEP only works when people have a supply of it on hand to protect themselves in the heat of the moment, essentially. Well, I'm not a physician, but we have a team of physicians at shamelesscare.com, and we have basically taken the approach that if somebody wants DoxyPEP, they probably need it, quite frankly. This is something that the vast majority of people are just not going to request, use, or frankly know about. But the people who do probably need it. And it doesn't just benefit the person, it benefits their other partners and potentially society as a whole. Look, STI rates were increasing for the past 3 years now. We've seen bacterial STIs, gonorrhea, chlamydia, and syphilis dropping by a considerable amount in the United States, and nobody knows for sure, but it's probably been because of DoxyPEP. And that's a huge public win for everybody. Well, I'm Robert from Shameless Care, and we will talk again in a few days.